Turning our attention now to the coronavirus, you test positive for COVID. You need something to help fight off the virus. State health officers are pushing one treatment for everyone, monoclonal antibodies. But what are they and how exactly do they work? Well, for starters, your body naturally makes antibodies to fight an infection, but your body may not have the antibodies designed to recognize a new virus like the one that causes COVID. Monoclonal antibodies, they like to call them MABs or MABs, are made in a laboratory to fight a particular infection like COVID. MAB treatment can help patients who are at high risk for severe symptoms or hospitalization. People who test positive with mild or moderate symptoms may be eligible for the monoclonal antibody treatment, especially those who have a higher risk for developing more serious COVID symptoms. Also depends on your health history and your exposure to the virus, as well as how long you have had your symptoms. As for the cost of that treatment, it's free. Insurance covers the cost of the treatment, and if you don't have insurance, your healthcare provider will be reimbursed from federal funds. And one hospital in our viewing area is using this treatment to slow down the number of people getting hospitalized because of the coronavirus. Our Rhea Thornton spoke with the pharmacy director at OCH Regional Medical Center about a new clinic starting to help more patients.
I'm outside OCH Regional Medical Center, where this afternoon the hospital started a monoclonal antibody treatment clinic for patients recently diagnosed with COVID.
We're wanting to reach out to more people.
Stacy Weaver is the director of pharmacy at OCH Regional Medical Center. She is one of the many people who helped put together the new clinic providing monoclonal antibody treatment to patients through injection.
OCH has an infusion center, but we thought that we could reach out and be able to treat more COVID positive patients.
This method of treatment will require patients to get 4 shots in 4 different locations on their body. Once patients receive the 4 injections, they'll wait in this waiting room for an hour to monitor for any reactions. Unlike the IV infusion, the injection form of MAB treatment will take up to 5 to 7 days to get the full effects.
What we're trying to do with this treatment is we're trying to keep these people out of the hospital.
Weaver said patients don't need a doctor's order. The state health department already ordered this form of treatment for patients who recently tested positive for the virus and have mild symptoms.
If we can try to reach out and meet all of those, then maybe we can get a better handle on this.
Weaver said patients still need a doctor's order to get the IV infusion of the MAB treatment. The Mississippi State Department of Health recommends that form of the treatment for those severely ill from the virus. However, if you recently tested positive and don't have many symptoms, the injections are an option. Reporting in Starkville, Rhea Thornton, WTBA 9 News.